Hi, I'm Proeschold-Bell, and I'm a psychologist in the Duke Global Health Institute. As my own way of coping with COVID-19, I sought to put this virus in perspective. I'm honored today to share two things with you. For about 6 minutes, I'll talk about human behavior during past epidemics, along with someone who's sheltering in place with me. Then for 4 minutes, we'll do a hope exercise together. We all have some basic human tendencies that situations bring out in us, and people have been living through epidemics and even pandemics for centuries. For that reason, I think it's interesting to start with an epidemic from a video game, the multiplayer online role-playing game World of Warcraft. Millions of World of Warcraft players spend substantial time each week interacting with other players. They develop strong communities and spend time and money building up their game assets. In World of Warcraft in 2005, the corrupted blood outbreak occurred. It affected thousands of players who took it very seriously, and medical researchers published a case study of their behavior in The Lancet. So what happened? In good news, many players rushed to help and cast healing spells. But the disease also spread quickly because many players in cities went to rural areas to hide, and some players continued to work in the game's marketplace. Too few players were willing to make sacrifices to contain the disease, with the major sacrifice being to abandon their pets who were spreading the disease. Ultimately, the game maker Blizzard had to reboot the entire game. I think the lesson for us today comes from Eric Lofgren, one of the medical researchers who studied this corrupted blood outbreak. He said, "We often view epidemics as these things that sort of happen to people. There's a virus and it's doing things. But really, it's a virus that's spreading between people, and how people interact and behave and comply with authority figures or don't. Those are all very important things. So how we behave matters a lot." Now, what about past real epidemics?
One past epidemic to look at is smallpox, which was worldwide for over 1400 years, and it was a big deal here in the US during the American Revolutionary War. Smallpox was so deadly. Among European settlers who contracted smallpox, 30% died. Among American Indians who had fewer previous exposures and so less protection, the mortality rate was 50% or more. Smallpox spreads through the air. It's even more contagious than COVID-19. During the American Revolution, smallpox spread because people were living in crowded conditions in cities under siege and in military encampments, and because people on ships infected each other and carried the disease to new destinations. People had to figure out a way to contain the spread, and they turned to quarantine with good effect. Sailors couldn't disembark from ships right away, and individuals who were sick underwent self-isolation. Eventually, there was an effective vaccine against smallpox in 1796. That took 1400 years.
We might also look to the 1918 flu, which was worldwide for a year, and a full 25% of people in the US got it. It's contracted the same way as COVID-19. World War I's conditions spread the 1918 flu as soldiers traveled, and then there weren't enough medical professionals in the US to care for people because they'd been deployed to the war. There wasn't a vaccine, so people isolated themselves, disinfected surfaces, and limited public gatherings. Sick people isolated themselves at home or in the hospital. Medical providers risked their lives for others and took what precautions they could. People walked to work rather than take public transportation. Funerals were limited to 15 minutes. To enter certain towns or take a train, you had to have a signed certificate. Many places closed schools. Stores were closed, theaters and movie houses were closed, and pool halls and bars were closed.
In good news, prohibiting gatherings made a big difference, which we know from some cautionary tales. 1918 was a time of patriotic parades in support of the war effort. Philadelphia held their parade and flu deaths there spiked. In contrast, St. Louis canceled their parade and all their gatherings and had a third of the death rate of Philadelphia. And it wasn't just those two cities. Researchers studied cities across the US, and those that aggressively shut down gathering spaces and did so early saw half the peak of the death rate. Still, the 1918 flu killed nearly 700,000 people in the US at a time when our population was only 100 million. Over the course of the year, that flu didn't just come once, but it had 3 waves. Why? Because we loosened up social isolation measures too quickly, and not just once, but twice. It was our behavior that caused the flu to have 3 deadly spikes.
On the upside, we're so much better off today. We didn't even know that the 1918 flu was caused by a virus until years later, and yet for COVID-19, within 2 weeks, we knew that it was caused by a virus and we'd sequenced its genome. In 1918, there weren't antibiotics to treat lung infections like we have today. Now, our hospitals are much better equipped with more space, more knowledge, and well-trained healthcare workers who are specialized in how to care for all of our medical needs. We can also track and communicate in ways unimaginable back then. This viral epidemic isn't unprecedented, and we actually know how to contain a deadly virus. And unlike smallpox, this time it won't take 1,400 years to get to a vaccine. The current isolation measures, they're going to take a real toll. We don't have to like it, but we have to do it. We can do it as millions of people chose to do for smallpox, for the 1918 flu, and for many more epidemics than I've mentioned here, including for polio as recently as the 1940s. Physical distancing is what people do to protect each other from these threats. So what's in it for you? Or maybe I should ask, who's in it for you? I'd like to take a couple minutes now to do some envisioning. So sit up straight, relax your shoulders, and take a moment now and think of someone you want to protect. Maybe it's someone who's older and more at risk from this particular virus. Close your eyes and imagine their face if you can, or think their name. Keeping your eyes closed, now shift gears and think about what it is you're looking forward to doing in the future. Travel, work, hugging a loved one. Imagine what that activity will feel like if we keep people safe today. Who's with you in your activity? We have to keep them safe. We have to keep each other safe. We know from the past that humans tend to loosen up physical isolation measures too early, but it's up to us, and we can stick with it and save lives. If you start to feel hopeless, it can help to remember one thing you're grateful for. In fact, do that right now. With your eyes closed, think of one thing you're thankful for today. You overachiever, you're probably thinking of more than one thing. And if it's the internet or medical providers, you're not alone. So what's your next step? What are you going to do to keep the people you just envisioned safe? Staying home might feel inactive, but it's actually a significant and brave action. It works if we all do it. We're going to have to keep each other strong to stay the course long enough to avoid multiple deadly spikes. And who do you think is staying home to protect you? Because people are. One last time, close your eyes and imagine their faces or think their names. Imagine them at home. Imagine the faces of friends, of coworkers, and of families all across your community. Imagine people young and old smiling at you. When you're ready, let your eyes open and come back to the room. We as a society have gotten used to mass communication. Now is the time for mass action, even if it feels like inaction. We know how to stem the spread of COVID-19. Admittedly, it's not normal behavior to physically isolate and shelter in place. We have to be intentional and as one large community. It's going to take time, but there will be a vaccine. And you, each of us, has multiple ways to shape our days so we can stay strong at home. What each of us does as individuals matter. Unlike in World of Warcraft, we can't reboot. Now is the time to take care of each other, as people have done in mass scale before.